these beautiful forests. Are we in Switzerland? No. Where are we? In India, in the Himalayas. More precisely, in the state of Uttarakhand, close to Nepal. Here, our Swiss-based association supports 4 NGOs that work in the medical, ecological, and educational fields. Our name is SHA, the Swiss-Himalayan Amity, a friendship that transcends borders. SHA is helping 4 different NGOs in the Himalayas. Arohi, which cares for education and healthcare. Arogyo, which is helping pregnant women and young mothers. Alap, which pioneering reforestation techniques lead the way to a sustainable future. And Can Kids, which helps children with cancer and their families. As more and more people quit to move to the cities, these communities find it harder and harder to survive. Building schools or hospitals does not suffice and is short-lived. Since the government is not fully aware of the degradation of the place, we need to step in to provide the necessary minimum to recreate a sustainable life for the inhabitants.
Arohi was started by my wife, Una. We together actually started this organization in 1992. The association grew very rapidly, and in a few years we had expanded to cover a large part of this district and helping almost about 100,000 people annually in all these sectors of work.
3, 4, 5, 4, 3, 2, 1.
I met this Indian doctor, Dr. Sushil, and there's this friendship, and through him I got to know other people which have encouraged me to stick with the support of the mountain people and help them in their possibilities and make it more livable for them. And you must know, the life of the mountain people in Uttarakhand is a hard life. It's a harsh life.
Look here. Hot water. Rajesh up.
Apart from kindergarten, there is a lower and middle school until the end of the 8th school year, complementing the state system. Special attention is given to young girls' development to ensure they will be exposed to equal opportunities. We promote creative development with a focus on music, dance, and sports. In addition, needy students will be provided with food supplements, and we award scholarships to children of low-income families and teachers.
अपना अनुभव है कि यहाँ पर बच्चे की हर एक्टिविटी पर बहुत ध्यान दिया जाता है और बच्चा कब खा रहा, कब पी रहा, किस चीज़ों पर उसका ज़्यादा रुझान है, इन चीज़ों को देखा जाता है और उसको उसी की तरफ आगे बढ़ाया जाता है.
We are having the digital classes, computer lab, as well as we are having the library of around 5,000 books. And one of the USP of our school is the student-teacher ratio is 1:12. With the support of SHA, Swiss-Himalayan Amity, this school has groomed a lot since last 20 years. We will be continuing best of quality education for the kids in this mountain area.
Arohi is also a full medical center with doctors and trained nurses who can respond to the injuries or sicknesses of the villagers. This woman has a broken spine and her injury needs a specialized operation. Otherwise, she would not be able to move anymore, as the doctor explains to her husband. This young man fell into a river. He died instantly. Nothing could be done here. The medical bus is another massive improvement in bringing care to the remotest villages, where people could not see any doctors. Here, once a week, they receive consultation, diagnostic and medicine.
इसका कोई अल्ट्रासाउंड नहीं होता है, मगर एक्सरे करके देखना पड़ेगा कुछ टूटा है नहीं टूटा है, अगर टूटा है तो कुछ करना पड़ेगा। ऐसे
पूरी पराठा ठीक खाते हो?
ऐसे तो नहीं खाते हैं, कहीं लगन काल हो गया तो तब खाते हैं, वैसे नहीं, घर में नहीं खाते हैं।
आयरन कैल्शियम के साथ साथ वो भी लेना। आयरन कैल्शियम है घर में कि यहाँ से लेके जाओगी? We came here with the bus which has the pharmacy facility and ultrasonogram and pathological facility. We gave them consultation here.
They wait at least for a month for the Arohi bus to come and give them service. They do not have a facility to go long way to get the medicines. They are getting at their doorstep.
We have an ultrasound machine and a lab with us. There is no availability of this kind of facility. We are serving the people like that, so it helps.
The second NGO helped by Shah is Arogyo. Arogyo means free of disease, and our program is committed to improving healthcare for a population of 260,000. Arogyo's primary focus is on the care of pregnant women, infants and young children, with the primary goal of significantly reducing maternal and infant mortality. Dr. Sushil Sharma created this NGO that is run jointly with Erika Datta. She relentlessly visits all mothers and children in the region to give advice and guidance.
स्तनपान अभी चल रहा है उसका
जी,
और बच्चे को अभी बड़ा हो रहा है, अभी 7 महीने का है, तो उसको 2 कटोरी खाना खिलाना है दिन में।
अरे सभी पकोल खाई ना, स्वादी ना हरे को, कहाँ को नॉन बाब?
तो वही इसीलिए We have a training program where we train the government staff, which includes the nurses and the grassroots level workers who are the village workers.
वेट के लिए जैसे वो नीचे नहीं देखता है ना, आप जब बच्चे का वजन लेते हो
ऊपर ही देखता है।
हाँ, तो उसका बैक इसमें लग जाना चाहिए ऐसे, इसका बैक ऐसे, पैर ऐसे सीधा। अब आप देखिए, generally we have a meeting with the mother and the families in the center where we talk about different topics related to the health and nutrition every month, and we also discuss how their life or the food style have changed over the periods, and we talk regarding the health and other stuff. We train the nurse on how to do the abdominal checkup, how to do the essential investigation, what they are supposed to do and say regarding their health and regarding their nutrition during the 9 months of their pregnancy. We focus on the training of how they can conduct a safe delivery.
We are now supporting the government hospitals and the government nurses, because it actually is the government which has the largest reach in the rural areas compared to small organizations like Arohi.
ALAP is the third NGO supported by Shah. ALAP's primary goals are reforestation, securing water and food resources, and increasing people's awareness of the environment. This is done with the direct involvement of mountain villages' inhabitants and in close cooperation with the government. All of this is under the direction of Shiba Sen and her team.
So ALAP is a project for the Himalayan foothills, and there we are restoring the lost native forests of the region. And through that, we're showing examples of great economic development opportunities for the local population, for the state, for the government, and for the mountain region.
The native forests in the Himalayas were destroyed during the British era in India. As a result, native pine trees spread across large areas in the region over time, destroying local biodiversity and threatening the basic livelihoods of the local communities.
The forest floor is covered with pine needles, the needles that fall from the pine forest. And these needles are very inflammable and contribute to the forest fires every year. This is a crisis. It's a global crisis, and we can see it playing out in the mountains as well. The governments have to act. The governments have to collaborate with projects like ours to scale it at a more meaningful level. If we don't do that, then we can see where the Himalayas are going and the world is going. We're all going with it. And frankly, the earth is going to be fine. It's us who's going down.
तो आप देख सकते हैं मेरी चारों तरफ से जिस प्रकार की बायोडाइवर्सिटी है ये बहुत अच्छी है हिमालय के लिए। जिस प्रकार से हमारे चीड़े के जंगल उग रहे हैं वो बहुत तेजी से बढ़ते हैं, वो बहुत खतरनाक है यहाँ की जलवायु के लिए और धीरे धीरे क्लाइमेट चेंज होते जा रहा है। तो हम इस प्रकार के जंगलों को देखना चाहते हैं, पसंद करते हैं।
ALARP is pioneering new techniques that allow trees to grow faster in a composite and balanced biotope that ensures a sustainable future for the forest and is an essential lifeline for people and animals.
And what I can say in these last 5 years, one very clear success story that has come is that we can grow native species in the Himalayas or any other context, even in the deserts of Rajasthan, using the methodologies of soil work that we've worked with, using the species combinations, using the planting methodology, that we have over a 90% survival rate.
आप देख सकते हैं बायोडाइवर्सिटी का सबसे अच्छा उदाहरण है। यहाँ पर 36 प्रकार के पौधे लगे हैं, बहुत तेजी से बढ़ रहे हैं।
Our donors are primarily investing in the people of the region because the young people are fleeing these areas. There's nothing for them there. There's no investment, there's no water, there's no jobs, there's nothing. By creating economic activity, by creating jobs, these young people are getting skilled. And when they find a lucrative job for them, something that they enjoy doing, it's a great joy. They're proud of their culture, they're proud of their land.
The fourth beneficiary of SHA is CAN Kids, which means Cancer Kids. Childhood is a time of wishes, desires, and dreams of endless possibilities. But for children faced with cancer, it is a battle for and with life. Every year, there are 400,000 children all over the world diagnosed with cancer. In India, nearly 80,000 new childhood cancer cases are detected annually.
The daily footfall of cancer patients in our outpatient department is 150 to 200 every day. 40 to 50% of these patients are children. What we have seen here is the patients suffer a lot from factors which are beyond their control. Like they have to depend on their own resources for getting treatment. Cancer treatment is quite costly and the government's support which these patients get are often not enough to continue the full treatment and also not enough to support the well-being of the families also. So we have to depend on different organizations like CAN Kids India who have been working relentlessly for the last 10-15 years.
When they come, we first ensure that we are here with you, like Yana is you are not alone, so we are with you. Whatever help, guide you want, we will try to help you. They didn't take any blood from outside, they didn't smoke, they doesn't take any alcohol, so lots of questioning on their own, so they doesn't accept that they have this diagnosis.
Our intention was to open a new ward for children with cancer in Uttarakhand. So this has a major impact on the families who have children with cancer because they don't have to go far away to the big centers in Delhi or wherever. They can stay in their state and have their children treated there. And the treatment is a long treatment, takes months.
We hold their hands from the very beginning to the end of the treatment throughout their journey. Give them psychological support like emotional when they feel disheartened or sometimes also कि जैसे कि होता है कि patient is in a 4th stage. So उस टाइम पे मुझे थोड़ा डिफिकल्टी होती है कि एक बच्चा है वो लास्ट स्टेज में है, उसको कैसे काउंसलिंग करना है, पेरेंट्स को बताना कि दैट योर चाइल्ड विल बी गोइंग टू डाई in some month or a some year. In a cancer field, we have to counseling in another way. We don't use any that term that we used in psychiatric department, like anxiety, depression. Patient also feel their here depression, anxiety when they listen about that, but we have to make connection with them so that they can अपना वो सब कुछ हमको बता सके.
Kids, they are giving investigation support, they are giving food, they are giving accommodations, they are giving medicines, they are counseling, they are giving emotional support. Cancer survivor patients also have a scholarship and they goes in abroad also. So Kids support lots of things. I think I'm very lucky I'm with Kids.
It is our aim, or it should be our human duty, to make a more equal society, a more equal world.